Okay, we are rolling. What's the difference in seeing an integrative medicine MD like yourself versus a naturopath, chiropractor, homeopath, herbalist, or alternative doctor?
Great question. Being an integrative medicine physician, I get to provide the patient what we consider the best of both worlds, or all worlds. So we have conventional training in conventional allopathic Western medicine. We get an MD. Most of us have a residency specialty, like mine was family medicine, but some people do internal medicine, or even specialties like cardiology, for example. And then they do a fellowship program, so it's going further training into integrative medicine. I was lucky to be one of the first integrative formally trained physicians and fellows in the country 20 years ago with Dr. Andrew Weil at the University of Arizona. And then after that, subsequently, I studied functional medicine, Ayurvedic medicine, acupuncture, neuroacupuncture, homeopathy, homotoxicology, physiological regulating medicine, and herbal medicine, and then eventually went into plant-based diet and lifestyle practices. And so this gives us an opportunity. What's different is that since we have the best of both worlds, chiropractors are limited, naturopaths are limited in what they can do conventionally. They can't order certain types of labs, they can't prescribe certain type of drugs or certain type of procedures, and vice versa. So the idea is, instead of seeing certain practitioners, a truly integrative practitioner has the ability to provide you like a one-stop shop of like all these different specialties. Now, each integrative practitioner may have certain experiences. Like me, I'm a little bit different because I've done a lot of training in my life because I started really early. But for most people, it's like they can get the understanding like what an herbalist will provide. An integrative practitioner, if you find a good one, they'll be able to provide just the same thing. So it's kind of like, instead of seeing many people, you're seeing one specialist, but that specialist has multiple modality training. And then that's nice because you're getting everything. And our goal as an integrative practitioner is always improving the outcome. And it's not polarizing or saying, this is better than that, don't take this, don't take that. So it's an outcome-driven, evidence-based, looking at the least invasive, cost-effective measures through diet and lifestyle first. And then if we do have to use things like prescription drugs or surgery or some kind of, a little bit more invasive modality, then it's like, how do we improve that outcome and lower the risk of side effects?
When do you recommend using pharmaceutical drugs versus herbs versus supplements versus food versus something else?
Western medicine is good and is best at acute care. So usually when someone, and that's usually relegated more to the emergency room or urgent care options. And so if someone comes in, they have a dog bite, or they have some kind of wound, or they're very severely sick and they're immunocompromised, for example, then Western medicines are good, acute issues. So for example, if someone comes to my office and their blood pressure is 210 over 110, and we get people all the time walking in with uncontrolled hypertension. I've not seen a doctor in 10 years, usually men or more. And we look at, how do I give a drug? Because I need to acutely clamp down on the physiology because it's more of a dire situation, right? I need to get them out of the risk of having a heart attack and stroke right now. But what we want to do is not just keep them on the blood pressure medicine. We want to look at changing the diet and lifestyle, all the epigenetic factors of their life, lower that blood pressure naturally. And then if they need to, we can switch them over to a natural herbal medicine that we actually have for blood pressure that works very well because it has least side effects rather than some of the conventional drugs, and eventually wean them off of even the herbs because really it should be the lifestyle that maintains their health.
Are the medical journals providing the most honest, up-to-date information on health and healing?
Wow. No, because the concept is, are they talking about science or scientific methodology or pharmaceutical drugs in clinical trials? Yes, but healing is not a part of that. So one thing that people forget or they don't understand is that in conventional medicine, the word healing is not even taught, right? So we can remove something, we can suppress something, we can treat something. That's different than healing. And so I'll just give an example for cancer. It's easy for oncology, as we say, to kill cancer. There's a lot of things that can kill cancer, radiation and chemotherapy, and that's sometimes indicated depending on the patient and the type and stage of situation that we're in. However, that has nothing to do with healing. And so through an integrative approach, we're looking at how do we, again, improve the outcome by giving you the best of everything. How can we give something that's targeted and lower the risk of side effects? Or, more importantly, how can we maybe avoid some of these things that have side effects and use something more natural?
In Chapter 1 of Inflammation Nation, what did you mean by inflammation, the common link to all diseases?
So inflammation is what we consider the triggering mechanism of all disease. So at the earliest stage of any disease, A through Z, and I'll tell you in a second what that might be, is that there's an inflammatory response. Inflammation means fire, flam, and basically the word means itis, I-T-I-S, right? So anything that we put at the end of the word itis just means inflammation of that area. So if you start from the head, like say someone has itchy scalp, they go to a dermatologist, we call it dermatitis. We can get red eyes, we call it conjunctivitis. Runny nose, rhinitis. Stuffy nose and pain, we call it sinusitis. Go to the dentist, we have gingivitis. We can then have, I'm having a little bit of laryngitis with my throat here, talking a lot. People can get sore throat, pharyngitis. People can get a thyroiditis. Heartburn and reflux and stomach pain is esophagitis and gastritis. People can get colitis. Men can get prostatitis. Women can get vaginitis. We all can get arthritis, tendonitis. So there's over 200 different itises now in the medical diagnosis compendium. But the idea is that we have to look at what's the underlying triggering mechanism that comes into that patient and their diet, lifestyle, and environment that triggers these inflammatory responses.
In Chapter 2 of Inflammation Nation, what did you mean by an introduction, 10 steps to optimum health and longevity?
In my experience over the last 20 years being an integrative medicine physician and specialist in this area, we've looked at what were the epigenetic changes or factors that have been proven in science that we need to do with diet, lifestyle, environment, and belief system. And so over time, watching my patients' profiles and also changing my health in the meantime, we looked at what are the steps. So I created this book for the reason is that when I spend time with my patients, usually 2 to 3 hours per patient, okay? And I'm booked for many, many months. And so the idea was to create a book that people who can't come see me, they can still follow the 10 methods. And these methods are proven. The book has over 450 pages of information, but over 1,500 scientific references and studies, and investigative journalism as well, because there's other parts that we look at in health, to look at, this is the stuff that we need to give to patients to empower them. And if we empower them correctly, 80%, if people follow these 10 steps, 80% of their condition will resolve. Okay, why is it not 100%? Because that's when you need an integrative or some kind of healthcare practitioner, because most people will be on medications that might need to have some tuning or even a weaning off, and some people might have other chronic issues that might need some more laboratory testing or some more other evaluations. And so, just following this as a basic guide, even if you don't have an integrative practitioner, you can improve your health dramatically.
In Chapter 3 of Inflammation Nation, what did you mean by Step 1, eating an organic, non-GMO, plant-based, anti-inflammatory diet?
So at the end of the day, the first step that everybody just always go home with is you have to be eating good food, right? Food is medicine at the end of the day, as everybody says, right? But we have to understand what type of food. I always give the analogy that, to my patients, think of your body as a Ferrari, okay? If you have a $300,000 car, you can only put good fuel in that car to run. You can't put cheap fuel. If I tell people, if I give you keys to that car right now, and if the car was on empty, you be very careful which gas station to go. I want a special octane fuel for the car to run. NASCAR fuel, for example. You're not going to go to a cheap pumping gas on the corner, right, for a low price. But for a strange reason, we don't treat our body the same as our car. So we actually put in cheap food. We put in cheap fuel, and then just like a car, if I put diesel into a Ferrari, it's going to start pinging. Then we're going to go to the mechanic. The mechanic's going to say, you got all these things wrong with you. We got to remove this. We got to, same thing with doctors. We got to remove this, or we got to rechange this out, right? So we have to look at starting with a whole food plant-based diet, which is anti-inflammatory. So at the end of the day, we have to look at what foods are anti-inflammatory, which ones are pro-inflammatory. So before people get into like what's an animal protein or what's a plant protein, I just say, is it pro-inflammatory or anti-inflammatory? And if it's pro-inflammatory, you shouldn't be eating. If it's anti-inflammatory, you should be eating more of that.
In Chapter 4 of Inflammation Nation, what did you mean by Step 2, testing what is triggering inflammatory responses in your body?
So the key of looking at individualizing healthcare is not just moving to a plant-based diet, because we already know that that's what all the science says. All the studies will show unanimously, right, is that we should be using a whole food plant-based diet to reverse almost every single disease or prevent it from getting worse. Okay? But we have to then look further. What we do that's different than most practices, that we look at individuals' responses to all foods. So for example, where sometimes people will fail going to a plant-based diet is that they transition, say, oh, I watched this movie, The Game Changers, for example, a great movie, or Forks Over Knives, or What the Health. And they say, I want to change my life. I want to change my diet. But if they have a food sensitivity of some kind that they don't know, then they're inadvertently eating more of those foods, and they actually can trigger an inflammatory response. Food sensitivities are interesting because a lot of people were thinking about food allergies. And in my book, I'll talk about my food allergies, particularly, where I have an anaphylactic reaction to nuts, for example. So most doctors, most patients think of these life-threatening, you eat something, your throat's going to close up and you need an EpiPen or you need to go to the hospital. But there's a lot of other type of reactions that people can have that happen within an hour that's not life-threatening. It's called an immediate reaction, but it's not life-threatening. There's also a different type of reaction that can happen a few hours up to 4 days later after the patient consumes. It's called a delayed. And so what happens is when people move to a plant-based diet and all of a sudden they're eating a lot more berries and seeds and nuts and mushrooms and onions and, and beans, you can still have a sensitivity to those, even if they're organic. So what we want to look at in our practice is individualizing the diet. So it's not only going to what the science is of plant-based diet, but looking at each person's specific immune system function and looking at, is everything still anti-inflammatory, or if there's something pro-inflammatory coming in from an immune perspective, let's remove that. Some of these things we can reintroduce back into the diet, but the elimination of all those things gives the perfect health.